My research question is, how do network factors moderate the association between distance to clinics and physical health outcomes of parent caregivers? To reduce caregiver burden, parents rely on their support networks, which often includes family members and close friends. Important factors of a support network are network size, socially close members who are in the parent's inner circle, and geographically close members who live an hour or less away from the parents. For this project, I used data from parents who provide care to their child affected by inherited metabolic disorders. This is a heterogeneous group of disorders in which a single metabolic pathway is dysfunctional. Given the dynamic nature of this disease, it is important for parents to have a nearby metabolic specialist who could provide care to their child. To begin, I compiled a list of 170 metabolic clinics across the United States and calculated the distances from our parent caregivers to their closest metabolic clinic. I found that areas along the Northeast, California, and Texas are densely populated with clinics, while most states in the Midwest, especially in rural settings, are not. The concentration of our parent caregivers in high-density areas is consistent with what they've conveyed to me during their interviews, in which they've emphasized leaving behind their support networks in favor of living closer to a metabolic specialist. To answer my main research question, I conducted moderator analysis using the three distinct network factors and found that the proportion of geographically close members served as a significant moderator. As you can see in the graph on the left, looking at the long dashed green line, parents who live more than 3 hours away from their closest metabolic clinic and have less than half of their support network living within an hour are expected to experience poor physical health. It is interesting that the proportion of geographically close members was a significant moderator, but not the total number of geographically close members. These results indicate that a cognitive process may be at play as parents evaluate the availability of their social support system. Based on these findings, I think that it's important to increase medical and community resources in areas in which they are deficient. Looking ahead, I'd like to dive into the qualitative interview information to better understand the factors that promote and restrict parents from relocating.